think the obviously also a very important risk factor for the development of cardiovascular disease, particularly of the heart, and as you say, the fairing up of the arteries that we call atherosclerosis. And like blood pressure, you have to consider what we inherit in terms of the genetic contribution to having raised blood cholesterol. And we do. There are a number of genes that we inherit from our parents and grandparents through our parents that predispose to high blood cholesterol. But there are ways and means of finding out what our lifestyles do and what the environment does to us. And roughly speaking, you can look at studies of identical and non-identical twins, and you can actually calculate that the genes on average are producing about 50% of the variance in variation that you see in risk of cardiovascular disease. Oh, right. Importantly, that means about 50% is due to the environment in which we live, what we do in that, what we eat, what we drink, how we behave, what our environment does to us. That's changeable, that's modifiable, and that's the risk that we've really got to get a handle on. Yeah. I think a lot of the perhaps attention has moved away from diet and lifestyle because we have such effective therapy for lowering cholesterol with these statin drugs now. But you can intervene with diet and lifestyle changes to prevent the need for drugs. That's not the case with everybody, but if you try modifying your diet and lifestyle for a period of months, it used to be a 3-month period, to see whether you can manipulate and lower your blood cholesterol, that just might mean that you're prevented from going on to a lifelong therapy of statins.
Because they're not, I mean, they do work for a lot of people, the statins, don't they? But they also have a lot of side effects. So if you can avoid them, then... There are no drugs that don't have side effects. It's a benefit ratio of improving symptoms and then having side effects. It's just a question of getting the right drugs for you and trying to get the right balance. But we don't really want to have to go there. If there's ways and means through diet. Now, when it comes to modifiable factors in your diet and lifestyle, there are two main factors. Obviously, the amount of food that you consume, you've got to try and moderate that so you don't gain body weight. Although the relationship between body weight and blood cholesterol isn't as strong as you would think it is, actually. Although if you lose weight, your blood cholesterol tends to come down. It's not as strong a relationship as when you lose body weight, your blood fat levels drop considerably. Your cholesterol isn't so tightly associated with body weight, but nevertheless, you've got to try and reduce, not consume too much energy from food. If we look at the quality or the type of foods that we eat, there are two main things to consider. And these aren't just my favorites. I'm not giving you these because I've worked on one for 30 years. We have national dietary guidelines in the UK that have been formulated by the Scientific Advisory Committee for Nutrition, and they're endorsed by the Department of Health and Public Health England. So these what I'm going to talk about next are relate to the types of nutrients that we eat that we can modify in order to lower our cholesterol. Now, the first one is no surprise, and that is reducing saturated fat in our diet. Saturated fat is by far the major component for regulating, or if you get too much saturated fat, raising our blood cholesterol, the bad cholesterol. We call it the low density lipoprotein cholesterol. That's the cholesterol that gets into your arteries and furs your arteries up. Now, if you have too much saturated fat, your blood cholesterol is increased. So the recommendation is to try and remove that. And when you remove it, you've got to replace it with something else. So you either replace it with another type of fat, and that should be unsaturated fats, the monounsaturates and the polyunsaturates, or carbohydrate. There's problems with carbohydrate because that often has an adverse effect as well. So the replacement of saturated fat with unsaturated fats is very important. And we can do that in terms of exchanging cooking oils and spreads, and a number of foods that we know are rich in saturated fat, processed meats, pies, pastries, biscuits. We know the offending foods. Yeah, the sort of the highly processed or the ultra processed. It is largely, those. But I mean, what do you think about things like cheese? I mean, it is still a good dietary staple, isn't it? So maybe just moderate it rather than cut it out. Yeah, dairy is slightly different as a food group because there hasn't been the same kind of, it doesn't have the same kind of impact in raising saturated fat in some of the certainly fermented dairy foods, things like cheese and yogurt,
don't seem to have the same impact. Even though they contain saturated fat, they don't raise LDL to the same degree as some of these other foods, processed meats and all of the lists I've just given you. And there are reasons for that, because there are other components in dairy that might prevent the absorption of saturated fat in our guts. It doesn't mean to say that you can eat masses of cheese, and because dairy is very energy dense, but it doesn't mean to say it's also very high in nutrients. And if we start to exclude foods because they contain a saturated fat, in that case, you start to affect the balance of nutrients. The other group that I want to say was the type of carbohydrate. And we all know about having to limit the amount of free sugar that we consume. There's a guideline on that.
Can we just explain for the listeners what free sugar is?
Yeah, well, free sugar is the sugar that's added to sweeten our foods. So it's added to foods, confectionaries, table sugar, sucrose is one of the main forms.
It's the white refined stuff that you put in your
white refined sugar that we we sweeten our foods with. We sweeten our fizzy drinks with it. And there's a limit on that. But as importantly, if not more importantly, is getting another group of carbohydrates to lower your blood cholesterol. And that's dietary fiber. We're not getting enough dietary fiber, and that I think we have a guideline on that. Around 30, we're supposed to be getting about 30 grams a day of dietary fiber. We're nowhere near that. We're about a third of that in the UK, and we need to get more dietary fiber. Now, this is coming from all sorts of food sources. It's coming from vegetables. It's coming from pulses. It's coming from whole grains, and both there are different forms of fiber, some soluble, some insoluble. Both forms of this fiber are very good in lowering your blood cholesterol. So it isn't just saturated fat. Yes, we have a guideline on saturated fat. We shouldn't be eating more than, it's about 20 grams for a woman, about 30 grams for a man. We have guidelines on not over consuming too much sugar, because we passively we like sweet foods.
Well, it is slightly addictive, isn't it? It's just the way the brain
it is, and it makes it's a pleasant sort of hedonistic thing to do. We like sweets, we like chocolates, but we do need to just limit that. It does contribute to our body weight, but probably isn't impacting on as much as the hysteria around sugar, that sugar's toxic, and it's it's alcohol without the buzz, and it's the new smoking. I think that's slightly exaggerated. If you consume very high levels of sugar now, and I have to say, some of the there are groups in the population who do consume a lot of fizzy drinks and confectionery, but even they're not getting to the kind of levels that we can feed people in experiments and produce very extreme effects that have got into the newspapers and caused a lot of the hysteria about sugar. Very bad for teeth. There's nothing to be said. It's one food. If you removed sugar from our food chain, it would almost eradicate tooth decay. And there's very few foods you can say that for. And if you removed it from our diet, we wouldn't see anything like the amount of dental caries and tooth decay that we have in children, which was really quite shocking.
It is.
So aside from its effect, how it contributes to our body weight. But at the other end, in the middle, you've got a big group of things we call starches that we get in our staples, like our potatoes and our breads and our rice and our pastas. They have sort of variable effects. But at the other end, you've got these, your starches and your sugars are absorbed very rapidly in the upper part of your gut, whereas these fibers are getting past that. They're not absorbed. We're not getting energy from them directly. They get down into our large intestine, where the bacteria in our large intestine feed on these fibers. And some of the effects of lowering cholesterol are mediated through the bacteria, because the fibers are they're fermented by these bacteria, and they're some of the products of that like short chain fatty acids, we call these. They have very powerful effects on our metabolism, but they have a number of very influential actions on lowering blood cholesterol. So getting enough fiber and reducing the amount of replacing your saturated fats with unsaturated fats are the two sort of key things. Yeah.
And I think also I think everybody knows about the Fiber Day message, but
when I do the nutrition webinars for organizations, I kind of say, actually, fiber just got fashionable. It isn't about the 5 a day that you used to think about in terms of number of times you visit the bathroom. It's actually about, as you just said there, about microbiome, because there are studies that show that people who are more clinically obese have a less diverse microbiome.
Yeah.
And we know now that your microbiome is not just about having you or helping you to be a healthy weight. It's also your immunity. It's also your mental health. And I think people are just slowly beginning to realize that actually this microbiome is pretty amazing, that we're only just getting a handle on it, really. And to encourage it to flourish is to feed it. And one of the things to feed it is fiber, as you say. And so including or encouraging people to eat 30 a week challenge rather than focus on this 5 a day, because it is about diversity, isn't it? You know, nuts, for example, isn't just one of your 30. You know, almond is one, Brazil is nut, cashew is 3. You know, nut is not one category, there's subcategories within it. So really encouraging people just to eat more breadth. Stop eating so much bread, pasta and rice. You know, go for broader than that. And definitely more towards it. And you will see within a short period of time, there will be really positive changes.
Some of the, I mean, some of the data that for the effects of dietary fiber on diseases of the gut, cardiovascular diseases, diabetes, they're some of the most impressive data we have for the impact of diet on disease, chronic diseases. They really are. So I can't understate the importance of dietary fiber.
It's just something simple and easy that we can do, isn't it?
Yeah, and it's one of the concerns that we have at the moment is the fact that excluding one macronutrient or another has become very fashionable. And one of the nutrients, the macronutrients to be excluded, is carbohydrate on higher fat diets, ketogenic diets. These do have effects on our physiology, on our biology that may help us lose weight, may affect appetite, our nervous system. They have central effects on the brain. But the exclusion of carbohydrate does have a knock-on adverse effect on the microbiome, the gut bacteria. High-fat diets are invariably higher in protein as well, and more protein starts to get down into the large bowel and intestine, and that can have adverse effects on the gut wall. And it is a bit a concern that excluding one macronutrient over another will have long-term implications for our health. So it's not.
That's